Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. Thank you so much for joining us in this session today. We are on the last day of summer series and we'll get started in just a few minutes as we're waiting for folks to join. But thank you so much for joining us today.
Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. Happy to be here. Thank you.
Glad to be here as well.
Same here.
So we're just gonna wait a minute or so, just wait for folks to come in and then get started. Yeah. I hope everyone's having a good day. It's a gorgeous day, at least here on the East Coast. So after a few days of rain, so. I think folks will join us, but I'm just going to go ahead and get started. Once again, Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. My name is Rucha, Kaur, and I'm the Community Development Director at the Sikh Coalition. I am so excited to welcome you all into this panel today. This is our last day of summer series. This has been a week-long event, virtual event. We're trying to bring community members together to have important conversations, discuss important issues that are important and relevant for our Sangat as a whole, and engage in fun activities for all ages. Today, I have the absolute honor and privilege of being able to welcome a fantastic panel to have a conversation on an important issue, raising Sikh kids, understanding our children's mental health needs. And we have three awesome panelists with us, Dr. Ravinderpal Singh, Dr. Jasjeet Kaur, and Dr. Muninder for Ahluwalia. So welcome everyone. I just would like everyone to just keep in mind that you're absolutely able to ask us questions through the Q&A function at the bottom there. And thank you again for joining us. I just wanted to start by introducing our panelists. Dr. Jasjeet Kaur is an adult, child, and adolescent psychiatrist. She has worked for Bronx Children's Psychiatric Center, U.S. Army at Fort Drum and Fort Bragg, Palo Alto VA Medical Center, and she currently works for the San Joaquin County Behavioral Health Service in Stockton, California. Thank you so much, Dr. Jasjeet Kaur, for joining us today.
Thank you for inviting me. I'm happy to be here.
Thank you. Next, we have Dr. Ravinderpal Ravi Singh, who's originally from Bay Area, California, but now he's in Northern Virginia. In 2017, he completed a fellowship in child and adolescent psychiatry at the Virginia Treatment Center for Children, Virginia Commonwealth University, Richmond. And since then, he has been working at the Innova Keller Center as an outpatient child psychiatrist doing medication management and providing coverage for the partial hospitalization program. Welcome, Dr. Ravi Singh. Welcome to the panel and welcome to the summer series.
Thank you. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. Glad to be here.
And then we have Dr. Muninder Ahluwalia. She's a professor and co-coordinator of the counseling programs in the Department of Counseling at Montclair State University. Dr. Ahluwalia engages in scholarship focusing on intersecting identities of racial and ethnic minorities in the US, with specific attention to the psychological impact of racism and discrimination on individuals and communities, including our own Sikh community. She also has a consultation practice where she conducts a multicultural competence assessment and training. Welcome, Dr. Ahluwalia.
To be here.
Thank you. So I just wanted to get the conversation started. You all have clearly a lot of expertise in your fields, but I wanted to start by having a conversation around what has been your big aha moment in the field of working with children and mental health. Feel free to start, anyone.
Okay, I'll start. So, you know, when I first started working with children and adolescents, my biggest thing was how can I make an impact in their lives. One of the things that ended up being an aha moment for me was planting a seed which in the sense just giving them some insight into what's going on with them, maybe helping them with building some coping skills, just planting that little seed of what might be going on. And then they themselves do all the work over time. They nurture that plant, they water that plant, they do what needs to be done to keep that plant alive and growing. And so that planting a seed has been really, really important, and has been something that I feel that has been my contribution to taking care of my patients.
Yeah, I want to add to that. Definitely, I think one driving factor for me to start working with child and adolescents in psychiatry was, trying to catch issues early on, as the brain is developing. And it develops so fast, especially in the first decade and a half, and the opportunity to change individuals' lives. A small degree of movement in that age is a huge trajectory change, down the road. So it's always a pleasure to see kids at a young age and help them, and then be rewarded and see them, flourish.
I think for me, it's that sort of mental health is tied so tightly to identity, particularly for marginalized populations. And so all identities, so religious identity, racial identity, cultural identity, social class, et cetera. And I think for me, the more I saw those links, the more important it became to help bolster and help encourage development of a healthy, healthy intersecting identities for kids. And in turn, that helps to bolster mental health. So that's sort of why I went into psychology, is to sort of help people find their way to wellness. And for each person, it looks a little bit different depending on who they are and where they come from.
Yeah, that's so important, right? To keep in mind who we are and where we come from. And so when we talk about specifically within our community, are there specific insights you would like to share about children in the Sikh community and mental health?
So there's definitely a lot of stigma around mental health in our community. I have noticed that schools put in referrals for kids to be seen, and a lot of times parents don't follow through on that. And part of the reason is, I mean, there can be myriad of reasons for that, but I think coming from an immigrant community, stigma is one of the biggest one. They don't understand too much about mental health, so they don't understand how serious it can be. A lot of parents have come in and tell me that they don't want to be blamed for what is happening with their child. They don't want to think that they somehow played a role in what's happening with their child, like they didn't do good parenting. So that comes in. They worry about their immigration status. They worry about what if their child is gonna have trouble tomorrow getting into a good college, or even getting a job in the future, how it's gonna affect them. They worry about, police or child protective services or other things like that getting involved. So there's lots of things that become a bit of a problem when it comes to getting the help that they need.
Very, very insightful, absolutely. And we will talk more about the stigma and what we can do really to be supportive. But Dr. Ahluwalia?
Yeah, I mean, I think that's absolutely true, that there's a stigma. And I think you could say that generally in the South Asian community and many communities, and particularly communities of color. But I think there's also a thing where I think we have a narrative in Sikhi that's about, how do we be a Sikh, right? And the way we be a Sikh is to be strong, to live in Chardi Kala, to be brave. And sometimes we oversimplify those things for ourselves and then for our children, right? So we try to we don't want to see them in pain. We don't want to see them sad. So we try to maybe skip over let's figure out how to let's figure out how to cope. and we go directly to, let's live in Chardi Kala. And Chardi Kala is not this sort of simplistic, like, let's be happy, la, la, la. It's how do we fight to maintain optimism in the face of adversity? And that requires internal, mental, psychological, emotional health. So I think that there's a narrative that we have that's good, which is we are brave, we are courageous, we are strong, we are advocates. But sometimes we forget that we also need to take care of ourselves to do that, right? So I think sometimes that narrative.
And we do have this, as part of my work at the Sikh Coalition, I do a lot of bullying presentations, and we do tell kids it is a sign of strength to be able to ask for help. And I think that narrative also sort of applies here as well, for sure. That bravery and strength can also be in asking for help and recognizing that there is a need to ask for help, for sure. Absolutely. Dr. Ravi Singh?
Yeah, I think my sisters have covered most of that, right? What I want to add is there's this notion of the stigma, particularly as, it's an understanding that it is a medical illness, right? Depression, anxiety, ADHD, whatever that might be. Diagnostically, it is a medical illness, just like something like diabetes is, or high blood pressure, or high cholesterol. And so when you look at it under that light, it makes sense. Also, the stigma of, like, cultural aspect of it is that's not for us. That's more of an American thing. It's a, but the reality of it, in my experience, I don't know, and I can speak to this as well, is the parallels with Sikhi and the parallels of, therapy is a very much part of Sikhi. Guru Sahib utilizes it a lot in Gurbani. Essentially Gurbani is therapy. And so any good therapist would be able to bring out those qualities in that child or in that person as goals and objectives to reach toward. So if it is Chardi Kala, we don't all get to Chardi Kala all by ourselves. We're not expected to be just born with it. It's something you practice and you develop and hone in. So that's the job of a therapist. That can be the job of how medication can sometimes help in certain situations.
Absolutely. Maybe this is just wishful thinking on my part. As a whole, I feel like our community, we tend to shy away from these conversations around mental health as adults, as children. But more recently, and especially, underplay conditions like anxiety or depression. But more recently, I feel we're a little bit more open to having these conversations, and we're paying more attention. We're a little bit more in tune. Is that just wishful thinking on my part, or am I onto something here? Are we seeing a little bit more of that? And if we are now, any insight into why now?
I think there's several reasons. One, environment is changing, right? And not just the physical environment. There's virtual environments in play. Not just post COVID-19, but even before, social media, Facebook, Instagram, Snapchat, all those things, right? So it's opening a space for dialogue, especially with the newer generations. And then also as a community in the United States and abroad, we're evolving. Second generation, third generation, fourth generation, depending on which part of the world you're in now. And as you evolve and as you understand and integrate and assimilate within the educational systems, you start to learn the lingo and the understanding. So I think that creates an openness, to some degree destigmatizes our newer generations. I think those are one of the two of the reasons.
And I think it's I think you sort of were saying this, Ravi, which is that mainstream culture is more accepting of mental health issues, right? We talk about it more in mainstream culture, so it makes sense that Sikhs are going to reflect some of that influence. I also think that more and more we think about how mental health and physical health are tied and sort of, again, inextricably linked, right? So it's hard to talk about one without the other. You can't just be in shape and that makes you healthy in physical shape, but you also need to be in good psychological health. And talking about what does that mean, what does that look like,
I agree that parents are a lot more open to talk about mental health issues now than they used to be. However, I still think that there's a lot of work that needs to be done in this area. I think our the newer generation is definitely much more open to it, but um, when it comes down to actually getting help, they're still lagging in that. They Our school-based counselors that I work with tell us all the time, and I'm talking about our population here, Sikh community that I work with here, that they ask the parents or they tell the parents that the kids do need to be tested, they do need to be seen by someone, and they will listen to it, they will agree that there's something going on. However, it still takes them sometimes 6 months to a year to actually get them into an office to see someone. So a lot of education and training needs to be there, which I think that we are still lacking
Right.
in my personal experience here.
So that we've just started having conversations.
Right.
We're not seeking help. In some ways, it's almost like, oh, it's, you know, it's a problem, but it doesn't sort of apply to me, kind of a.
Correct. We still have that mentality where, you know, if a child has cancer, you're not going to tell the child buckle up and get over it. But if a child has depression or anxiety or has symptoms of that sort, you're very easily saying that to them. You know, you're strong, buckle up, get over it, it'll get better. You have everything. What do you not have at this point? We don't do that to people who have medical illnesses. We actually take them to the doctor, we get them treated. That part, I believe, is still missing. That little link is still missing.
It's almost like we have to reframe that, right? Like you said, I think that's very powerful, because if you're hurt or if you have a fever or right, if you have a cold, it's not like, oh, you'll get over it. Well, yeah, but you know what I mean, right? It's like you'll get over it. But when it comes to some of this, I think it's just how we think about getting help. If I could contextualize this in our present circumstances, and Ravi Birji, you started talking about this a little bit, like changing physical environments. We're definitely in a very interesting, as she says, with understating what is going on, but we're in an interesting physical environment circumstance right now, and I just wanted to contextualize our conversation in our present, in the present circumstances, that a lot of parents are having conversations about COVID, uncertainties with school, distance learning responsibilities for parents and for children, and that can be very stressful for households. There is limited social interaction. What are we doing as a community, or what should we be doing? Why should we be having these conversations right now, especially?
Yeah, it's important to, you know, educate ourselves about obviously what's going on, but it's in terms of COVID-19 and safety. But then I see a myriad of responses in families, right? Some people are over sheltered in, some people are under sheltered in. So there's a variety of things, but specifically with kids and just humans in general, we're very social. We thrive and we're healthy when we are able to socialize with each other. There's a lot of brain physiology that dictates that, right? And so specifically more like the face-to-face, you know, the talking, the hearing, the singing, the music. So a lot of Gurdwara aspects of what Guru Sahib put together for us actually is very calming and it's very therapeutic. And for some that we might be missing out on, depending on which part of the country you're in right now. So one way to do that is having virtual kind of conversations like this, where you are face to face, we are able to see each other's face. I mean, it's not going to be in person. Some people, if you're comfortable, you can do it in terms of social distancing and masking, etc. But the other aspects of kids and growing is their play. They learn through play, and they're not having that. So figuring out other ways and being creative to facilitate that play. You know, there's some virtual applications you can use to play with kids, and kids can play with each other online. I think House Party was one, just to name one. But there's also, again, creating that quasi environment then for those kids to make sure their development, you know, aside from just academic development, you're having that social development as well. And I think that's really important.
And I think things like, having, so part of that is the virtual stuff, right, that Ravi's talking about. And part of that is what do we do inside the home? How can we have rituals, some old, maintained from previous times, some new ones, right? So maybe as a family, you do, seva together every night. Maybe, you do these virtual kirtans as a family or extended family or a community, or, you engage in activity, you engage in seva. Seva might look different now, right? So you're not going to Gurdwara and handing out langar, but maybe you're sewing masks, right, for community members, or you are finding ways to advocate for Black Lives Matter, knowing humanity is inextricably linked, right? So I think a lot of these things are what parents decide is important to them, what they value, what's important as humans, what's important as Sikhs. And then, how do you enact them in these ways that are small, achievable goals, right?
Great ideas, absolutely.
Yeah, I agree. Wonderful ideas by both of you. I think social isolation right now is one of the biggest things that the kids and especially teenagers are experiencing. Within the last month, I've had a few patients come in and tell me that they miss not having that human contact with their friends and with their peers, because there are certain things that they feel much comfortable talking to their peers with than they do with their parents. So they can do that over the phone, they can chat, they can do all of that stuff, but it's not the same. So leaving school and sitting in a coffee shop and having this people conversing with each other, people coming in and out, and just having that sort of an environment is therapeutic for some of them, which they're not getting at all at this point. I had one particular kid tell me the other day that he misses fist bumping with the janitor at his high school. At the end of the day, every day he would walk by down the hallway and he would fist bump with the janitor. And this was an older man that he talked to every day. And he said he always had something positive to say to me. And I miss that. I miss just having that human contact. And so I think that it's important for parents to kind of, talk to their kids, have an open communication with them, and kind of understand what their frustrations are and what they're feeling, and acknowledge it.
And I think that's so important, right? I think that conversation and communication as a family is increasingly now more important. One, because we are all together all the time, but also that's how we are learning from each other. Even in families, we're getting to know what our days look like, or what are things that are really important to us on a daily basis that we're not able to do right now, for sure. We have a few questions coming in from the chat, and I know Dr. Jasjeet, you talked about tips for teenagers particularly, but there's a particular question about any tips for tweens and that age group. I know there was some conversation, but is there anything we can maybe tell this participant who's attending that they may be able to do with their tweens?
Well, there's the little kids. With the little kids, you can have a certain conversation with them, but it has to remain at a certain level where they understand. I think tweens are in that middle area where they're getting to be teenagers, but they're not fully there yet. So their understanding level is already there. So they do want to be more open and want to have an honest conversation about things. So I think it's important to do that for parents, to have an honest conversation about what they're dealing with. When it comes to mental health, the modeling is not there with the parents, which I think is very, very important which we need to incorporate. So if there are certain things that they notice or they see that are not going well, they have to be able to talk to them about it. But a lot of times they shy away from doing that.
Absolutely.
And I think sometimes those conversations need to be a little more scaffolded, right? So I think you're right. They're not little kids anymore, and they're not adults, or even, one could argue, teens. but I think that you can have a lot of conversations with tweens. They just have to be, we just have to break them down a little bit. And in fact, that process of breaking down the conversations is going to be much more helpful to the conversation, right? Because then we're not making assumptions about certain things.
Correct.
The other thing that I would also say is that I think the communication, we want parents to be as open as they can and not have judgment as much as they can. But the reality is parents are going to have judgment, right? So that is in some ways good, right? Some things are not good to do, some things are good to do, right? Don't eat the chalk, eat the carrot, right? So judgment is important, but I think part of what might be helpful for parents is thinking about what are your core values that you feel like you really want to communicate to your kids, and those are kind of a little more fixed or rooted, right? And then some of the other things you may be a little more open about and flexible about in ways that maybe you weren't thinking about being before, right? And sometimes that helps loosen up conversation with tweens who are kind of testing boundaries and all those kinds of things.
No, that's super helpful. Actually, I can jump into a question that has just come through. Do you have any recommendations for questions that may get some of these conversations started with children, whether it's something as simple as like, how was your day? But sometimes that isn't enough, right? I say this all the time when I'm doing presentations. I think sometimes we have to ask very pointed questions because a lot of time it's like, what'd you learn in school? Nothing. What'd you do? Stuff, right? Like, and so are there questions specifically that can help get us started?
Yeah, definitely. The right question will give you the right answer, right? So, or get close to what information you want. So, usually when I talk with kids, mine are still young, but even when I talk with them, you want to go for specifics. Tell me one thing that you learned today. Tell me one thing that didn't go well today, and tell me one thing that did go very well today. That starts to kind of get the ball rolling. And usually it's not that question, it's usually the start of that question. And through that question, you'll have more questions and more conversation, and you get them to kind of start to open up. I think that sometimes helps, because otherwise we'll say, oh, I don't know. And then, then you can kind of stop there, and then the conversation will stop there. But you have to kind of get creative and keep it open. That's one strategy.
That's a great.
I agree. Oh, go ahead. No, I was just going to say I agree with that. That's a very good way of. It is important to ask specific questions. I have a lot of parents who say they start out the conversation by saying, "What was the one fun thing you did today?" And so start out with something a little bit more uplifting, and then sort of make your way to something else that they want to ask.
And I think sometimes we want to ask one thing and we end up finding out something else, and that can actually be super helpful, right? So I think having these questions at any time is good, but it can also be helpful to integrate it into a ritual. So at dinner time, what are you most thankful for today? So you do this every day, right? What was really tough today, or something like that. And I think having these reflection questions integrated into your daily life can be helpful for everybody, and particular, I think, in terms of communication for kids and adults. There's, the New York Times has this at-home section, and this at-home section every week always talks about like these kinds of questions you can ask kids and things like that. So it's a good resource, I think. Some of the things will work for people and some won't. So it's worth a try.
Yeah, and also for younger kids, the little ones, I have a list of books that I give to the parents, and I tell them to go ahead and maybe have a conversation with the kids for social emotional skill building. I don't know if you can see this, but I can share this with you guys. And it's just a conversation starter for kids, for parents with their kids about sort of social emotional skill building, which they find helpful, especially for younger kids.
Well, that's super helpful. And both of those resources would be great. If you could send it to us, we'll make sure that we'll share it with the panelists that, the participants that have joined us today. I'm seeing a question or two about how to deal with either children who are not willing to participate or parents that might be in denial about needing help. Like, how do you navigate those circumstances, really?
Yeah, those are two different questions, right? So in terms of the parents and being in denial, I think that can be a tough one, right? And it really depends on the situation. To answer it more specifically, but I think conversations of maybe one venue is Gurdwara is using that as a venue to talk about mental health. It's perceived as something that's totally to the extreme, and a lot of terms that are stigmatized, stigmatic terms are like boggle or something like that, right? Which is not the case. Mental health, a serious mental health, that aspect of severe mental health is a very small percentage of the population. Like schizophrenia is like 1% of the population in the United States, right? So, but most common psychiatric disorder are anxiety, then depression, those things, right? And they present in various ways. So it really depends on what that situation is, and then how you would want to have that conversation and what that looks like. And so one quick way to kind of differentiate it is a key word is functionality. Is a person able to do what they're able to do? And if something is stopping you from doing what you're able to do, if you have a heart condition and it's stopping you from going and exercising and getting aerobics, that's a functionality issue. So similarly, if it's thought about anxiety or worry that's preventing you from doing what you need to get done, then it's an issue. Otherwise, anxiety is also needed to move and function.
Right.
If we didn't have the anxiety, we would have the opposite. You wouldn't want to care to do anything or worry about anything. So that's one example, just to help ground it and tie it down. And your second question,
The second question was more related to how do you get a child to engage if they're not willing to share their feelings openly?
Yeah, I mean, it really depends on, again, what the situation is, right? If it's something that's traumatic that really happened, then maybe you don't want to engage them right away. They have to be kind of ready to have that conversation. You have to have a safe place to have that conversation too. If it's over, if it's avoidance secondary to anxiety, maybe you need to have them calm down a little bit. And figuring out coping strategies, coping ways, getting them to kind of settle down and calm down. And then they might be more comfortable to have that conversation. One other thing I can maybe think of is maybe in depression, when somebody's just really down and they're just so immotivated, they're just so like dragging their feet, and then they're not having a conversation. So it really depends on the situation, how you would kind of push it forward.
I think, part of it for me is also like demonstrating empathy, right? So in a sense, answering both of your questions, a parent who's in denial, maybe, is I think what you said, and a child who's struggling, right? Is that if you're able to really empathize with what it might be like to be the parent or be the child, it sort of gives you a window into what they might be feeling, what might be stopping them. Sometimes denial, as Ravi was saying, is problematic, and sometimes it's healthy, right? It's a healthy coping mechanism. So people are not ready to talk until they're ready to talk, and you don't want to force something that when they're not really ready. And I think the other piece is really for parents to be able to connect to their own developmental experiences throughout their life. What was hard for them? When did they wish they had some help? Many immigrants came alone, or came as a couple, or came with their small children, and then they didn't have help here. So what would they have wished they had? And sort of thinking about, well, oh, I could have used some help. Maybe, finding some help for us and or our kids would be really useful. It would be a bridge to a better place.
Right, agreed. And I also think that we need to have, we have shortage of mental health education in our faith leaders. I think if early on, families and kids, as a family, we tend to go to Gurdwara every Sunday. That's something we've been doing all our lives, right? And I wish that there was more mental health education that was being provided by our faith leaders, or at least brought up and have a conversation, so that this was something that that they've been at least talking about and thinking about for themselves, so that if a situation like this arises, then there's some background information that's already there. I think when they're just kind of thrown in this situation and said, well, this is what's happening to your child, they kind of back off and say, oh, well, there's nothing wrong with my child. Well, why would you want him to see a psychiatrist, or why would you want him to see somebody else? So they back off because they just don't want to deal with it. So I think that if there's some education that was there beforehand, that we wouldn't be in that sort of a situation. So I think that is my one big thing I would like to see, that our faith leaders in our gurdwaras have a little more mental health education, and that they can continue that conversation at some point.
We're getting a lot of questions, and I apologize if we can't get to all of them. We'll definitely find a way to get these questions to our panelists, and find a way to make sure that you're connected moving forward. So I apologize if we don't get to all the questions, and I do see some very specific questions in here about specific cases, which I definitely think would be better for them to connect with you. But Jasjeet Benji, just on the basis of what you said, I think that is a great segue into a larger conversation around what can we be doing as a community and as a Sangat on a larger basis to be supportive of mental health conversations for young people, but also for folks of all ages. I think, how can we be more supportive of having these conversations as a Sangat?
Well, I think part of what I just said, that having that conversation coming from faith leaders is important, because people tend to listen to them. Having workshops, having seminars from time to time at gurdwaras, where you have people present to answer your questions, I think those would help. I've had parents come and tell me that, you know, as long as you are doing Nam Simran and you're meditating, that should be able to help you with your depression and anxiety, and you shouldn't have to need anything more than that. So that those kind of questions come in quite a bit, and I have to tell them that yes, Nam Simran helps, yes, meditation helps, but in order for you to focus and concentrate and do that, you have to be in the right place in your mind to be able to do that. And sometimes when your depression is really bad or your anxiety is really bad, you're not able to get to the point where you're able to focus and do that Nam Simran, right? So I think that some of that conversation in our community needs to happen, perhaps through gurdwaras, or perhaps through seminars and retreats, and kind of what we're doing right now.
Yeah, exactly. I echo those sentiments, right? And I think also, depending on the Gurdwara and the location, you know, utilizing even virtual, if you don't have an expert in your vicinity, utilize virtual training. You know, especially nowadays, it's become really popular, right? And also, Khalsa school teachers are another individual, you know, set cohort to train by subs. You know, I think Dr. Kirpal Singh, who is a psychiatrist, his vision is always to create like a Sikh chaplaincy, where there's kind of more, you know, in-depth knowledge of what mental health is and how to integrate that within Sikhi. You know, because we have our oral traditions from, you know, our grandparents to parents of Sakhiyan, and that really passes on the Sikh philosophy and Sikh psyche of Jardikla, and how our ancestors have dealt with really hard situations. That gives us kind of a framework to work with. And then we have the subset of Gurbani and how that can be empowering. But to what Jasjeet Benji earlier said is, Nam Simran is great. Of course, it is, you know, Sabro al Katnam, we hear that. But if you're not able to access that, if you're not able to function and you're shutting down, which can happen, it's very common for that to happen with something like anxiety. You freeze. It's our, you know, brain mechanism to do that. But if we're not able to calm down, if we're not able to access that breathing or meditation, for that lack of a better word, then, you know, we can't utilize Nam Simran. You also have to develop and understand it. So Sikh chaplaincy might be able to help bridge that gap. As you know, child therapists and child psychiatrists, we're very less in number, about 8,500 in the country for child psychiatrists. I don't have the exact number for child therapists, but there's very limited.
That's total, or that's
Total.
Sikh community?
Total
Oh,
in the United
okay.
States, yeah. So child psychiatrists like us and Dr. Jasjeet, Kaur, and even Benji, we're busy. We're very busy, and so we can be there to help train and maybe move things along, but the community has to start picking up and moving the weight on their own a little bit too.
And often, right, I mean, we spoke about Chardikala and so on, but often there is this conversation around using the concept of Chardikala to invalidate needing help, or even, right, how can we be more open around saying, like you said, Dr. Ahluwalia, right? Like being Jadikala is not being strong all the time. Like, how can we start having those conversations as a Sangat?
Well, I think part of it is right where you just said, which is in a Sangat, right? So Sikhi, by virtue of Sikhi, is about Sangat. And so nobody's supposed to go in a room alone and pray and that's it, and you're done with Sikhi. A lot of our strength in Sikhism and a lot of our spirituality in Sikhism comes from Sangat, right? So the question is, how are we using Sangat, right? And who is Sangat for us? And so I think if we think about leaning on each other, having open conversations about when our kids are having a tough time, when we're having a tough time with other Sikhs, I think that will take us far, right? Because that's, in a sense, that's what Sangat is for. Sangat is for, when you have pains and you have difficulties, you're able to rely on each other and lean on each other. Usually we do it around Sikh issues or Sikhism, or how do you raise Sikh kids in Sikhi, right? But it really is broader than that. It's about how do we raise our Sikh children to be healthy and well and be able to find peace and happiness and be the Guru Sikhs, right? So I think leaning on each other, both within the Sikh community and also outside the Sikh community, and join with other communities and have these conversations. The more we talk about mental wellness and mental health, not just mental illness, right? Mental wellness and wealth as a developmental thing that happens to us, right? Everybody gets sad. Everybody has hard times. Everybody struggles at different times in their life. It's a fact. And so if we acknowledge that, then I think then and we talk about it openly to each other, I think we go far.
For sure, right? We celebrate in public, but we keep some of this very private and very closed. But as we're starting, I think everybody, all of you mentioned starting to have these conversations and starting to have these conversations openly and in Sangat. Any tips or recommendations to getting started or making sure that there's a safe space in the Sangat to be able to have these conversations?
Yes, I know. I know Ravi can speak to this as well as Jasjeet, but I just wanted to say one thing about New York City Thrive. It's a mayor's office initiative, right, where they have people in government sort of going into places of worship and having the communication about mental health issues. Where do you find them? How do you seek help? And then training community members to be able to identify some things, right? So I think that to me is really, really important, is having open conversations and having us be able to talk to each other about what these are. Sorry, go ahead, Avi. You look like you were about to speak.
No, I think it requires logistical work, right? It's going to require a little bit of work as a community, but it starts with these conversations. All revolutions start with these conversations. So I think we're on a good path, and at least the local communities that I've been in, I've been trying to consolidate and try to develop a program or a space where kids can start talking about these things. There's rules and regulations and boundaries that have to be put into place, right? There's, you don't want to be sharing any private information. You don't want to be able to talk about topics in a safe way. Sometimes you can even enlist, like Muninder said, you utilize your community resources. So if you can get a social worker to help, have a seminar with you guys, have them understand the culture, our culture, who we are, our Seva, Simran, Gurdwara, and then, see if they can facilitate that in that way as well. So yeah, it's going to require work, and I think it depends on the demographic you're in to be more specific. I'm happy to have those conversations with anybody else in person if needed.
Either
I guess
one.
people also worry about, oh, I'm sorry. Go ahead.
Oh, please.
Oh,
Please,
I was just going to say, I guess people also worry about privacy and confidentiality when it comes to these things, right? That's one of the things that parents sometimes don't want to come right out and talk about it because they're worried that their information is going to get into the community. So even when we have these kind of initiatives and we have a safe place for people to talk about, they're still afraid to do it because they're afraid of their stuff going out into the community and other people finding out about it. So I think that we have to have this conversation where people need to know that whatever they tell us, it remains private and remains confidential, and it doesn't get into the community, that that's not something that we do, that there are HIPAA laws out there that go against it. And unless they give us permission to talk to someone, we do not talk to anybody, whether it's their doctor, whether it's police, whether it's law enforcement, however it may be, we don't talk to anyone without their permission. So that talk about privacy and confidentiality is very important at some point.
I was just going to say also about, I think you're right. I think parents are very concerned about that, and there's some merit to that. But kids seem to be much less worried about that generally. Not always, but generally. And I think that we have so many great resources with these Sikh camps, with things like Surat, things like Civic, right? All these spaces where people are having real conversations about mental health and being able to ask questions that they might feel, sound like quote unquote dumb questions, but they're great questions, right? Because they start conversations. So I think that all these spaces outside of Gurdwara are also great spaces to have these conversations.
As we're talking about sort of just shifting the conversation a little bit, are there signs that families should watch for, or that, that we should be looking out for? Anything that may serve sort of as a red flag, or anything that, that definitely, and I don't know if there is, but if there's anything that's like, oh yeah, we should be talking more about this, or like, let's talk more about this particular point. Anything that's like sort of a flag or a sign or anything like that you might want to share?
Yeah, a lot of times kids present with persistent low mood. They have unrational fears. Their sleep is affected. Their appetite's affected. They're not enjoying or doing fun things that they used to enjoy to do before. Self-harm behavior like cutting themselves or voicing suicidal thoughts. All of those things are red flags. And I think when they happen in clusters, when you're seeing a bunch of those things happening together, that's when you need to start getting worried and say, okay, I need to get some help for the child. So some of those things need to be important to look for. Basically, when all of that is happening, you'll notice that they're functioning in school, they're functioning at home starts to get affected, and they're not able to perform to the level that they were performing before. So that is definitely a red flag.
Yeah, I agree. And then for younger children, it might look a little different. Depression and anxiety looks a little different. You might not see the persistent low mood. You might see more irritability or easily frustrated. You might see, again, that same irrationality in thinking and fear, but you might see what the clinical term I'm using is regressive behaviors, where you might, an 8 or 9-year-old is starting to act more like a 3-year-old or 2.5-year-old, and those are sometimes like clinginess, thumb sucking, those type of things are usually more severe, but you can also look out for those behaviors. Are they becoming more withdrawn? Are they not as talkative, or they're not as playing as the way they used to? Those are some of for younger kids.
And I think along those lines, with age differences, there's also gender differences. So oftentimes people don't realize that anger is a big presentation for young men when they're depressed, and sometimes parents can misinterpret this anger and disrespect and try to just stop stop the anger and disrespect and not see that there might be something else behind it. So if there's a change, right, I think that that's one of the things that both Ravi and Jasjeet are talking about is also is there a change in the child, right? So you have one kind of child and all of a sudden it's a very different kind of child. I think that's usually also a red flag.
And I think the next question that logically just comes to me is if I'm seeing this, what am I doing? Like, what are some of the immediate next steps that I should be taking? That's just, I'm not a parent, but that just kind of flowed the logic in my mind.
Yeah, so a lot of kids, one avenue or way to seek help might be through your pediatrician, because depending on your kids, they're seeing the same pediatrician. You have a good rapport built with the pediatrician or group of pediatricians, and especially in the last, I would say 4 to 5 years, American Academy of Pediatrics has done a very good job in starting to learn about depression and anxiety, ADHD. And it's been part of their coursework for residents in training, as well as pediatric providers in their national conferences. So start to have these conversations and get training on these kind of how to treat mental health concerns. So that might be a avenue. Depending on your comfort, there's also school psychologists, school social workers, school therapists, counselors. That might be another kind of way of, hey, I need help. Depending on part of the country you live in Virginia, there's like community service boards. I don't know, in California or in New York, there might be government type institutions where then usually they have longer wait lists, so be prepared. Anytime you're looking for a therapist as a child psychiatrist, prepare for that wait list. That's what I'm saying, start with a pediatrician, so at least get this process moving and started.
And oftentimes pediatricians can connect you, right, to other resources. They may have a psychiatrist they work with. They may have a therapist that they work with for their kids. That can be helpful.
So one of the questions that came in is, this person is just really grateful for the conversation that we're having. And they're asking if there is like a resource for Sikh psychologists and therapists, because often it's a huge struggle to select a doctor because they may not understand, the Sikhi aspect of our lives, and that is really important. So how do you go about really making sure that the care that we're finding is culturally competent, I guess, to paraphrase what they're saying?
Yeah, so in terms of child psychiatrists and therapists, there is, yes, I don't know how many Sikh therapists or child psychiatrists there are. I've never counted, but I know a few, but I don't think that they're enough to meet the need of our community, right? That's one thing. But I can say that child psychiatrists, and within even my training in fellowship, cultural psychiatry was trained. It was a milestone for you to kind of move through and push through and graduate through. So understanding not just our culture, but even as psychiatrists, there's a standard of practice and standard of care of understanding the culture of the person that's in front of you and making sure you're meeting their needs to the best of your abilities and their understanding. So, cultural psychiatry has its own niche in our field. So, I guess, there might be some comfort in understanding that, right? No matter who's in front of you, they're going to try to do their best to understand who you are and where you come from for that specific reason.
I agree with that, because you're right. When it comes to finding a Sikh child psychiatrist or a psychologist, I have families that call me and ask me, can you find someone for us if you think our child needs help? And it's very hard to find someone. So I think it'll be nice for us to have a directory of people in each state, just to kind of have an idea if people are present. But on the other hand, I see a lot of kids who are from different cultures, from different countries. And the one thing that I like to do, and this is where what Ravi was saying is correct, is to learn about their culture and to learn about where they're coming from and how do they view mental illness, and how do they work as a cohesion, as a family. So I do the work when I'm seeing those kids, and I think that we are, as child psychiatrists, taught to do that. So I'm hoping that even if you cannot find someone from your own background, whoever you find will do the work and will get to know where you're coming from and what your culture says about mental illness.
And I think, you know, there's a directory, like lots of different directories, but there's a directory in Psychology Today, for example, that you can find therapists, psychologists, social workers, counselors. And one of the things they do is they talk about their specialty. And so you want to look for somebody who's, if I was looking for a therapist, I would say I would want somebody who's potentially bicultural, right? So they don't have to be Indian or Sikh, but maybe a person of color would be important to me. Maybe for me, it would be important that the person be bilingual, right? So they can think in more than one language, and that's an important skill, an important idea. So looking for similarities or things that are important to you and looking for buzzwords like multicultural or cultural psychologist or psychiatrist, those kinds of things are important because what those therapists and those psychiatrists are saying is they're saying these issues are important to me. And so even if they don't know a lot about Sikhs per se, they are interested, as Jasjeet was saying, they're interested and they're engaged in the process of learning about these communities.
One thing I wanted to add, if it was okay, and this is something I think as I'm having this conversation, I think this is something we need to really have a workaround for and start to prepare for. I've had conversations with some psychiatrists about this, especially in our community. You know, in the work we do, confidentiality, as we talked about before, is very important. Specifically within the community you live in, you know, it's hard to interface with somebody that you're treating directly, and not also compromise their confidentiality. In small rural areas, that's always a challenge, but I kind of view us in a similar light, right? So, and also be mindful of when you are approaching a therapist, don't impose a lot of like, let me get some free advice out of this. It's really not that easy. We can't just, you know, give you information and that's kind of like a way to fix things. It's very specific to each person. And so, you know, be mindful and respectful for that individual. But the confidentiality, maintaining the confidentiality is very important. So one solution might be if we had a list of child psychiatrists or child therapists, maybe if they're in different areas or different parts of the state, then they can manage those cases, and we probably need to coordinate it in that way. So, because you want to be able to have confidentiality available, essentially what I'm saying, so there's open dialogue. So you can really get to the root of the issue. And usually when we do that as a child psychiatrist, I usually start seeing differences and changes happening pretty quickly after that.
I think both of those are really important, right? I think it's great being able to find someone the way you said, right? Like maybe a person of color, maybe you speak some different language. That just kind of broadens your horizon, opens up more option. And definitely Ravi Viji, right? It's always hard, even if you're in the same Sangat or if you're part of like this bigger network, and we do, right, as a community we tend to know each other. So yeah, I think that's very important. We are kind of at time. We're going to go a couple of minutes over. Again, if we haven't been able to answer your questions, thank you so much for sending them. We're sorry if we haven't been able to answer your questions, but we will make sure we'll do something to connect folks so that folks can get the information that they need. I really wanted to sort of close on or start to close on what would be sort of your top recommendations or suggestions or concrete steps that we as a community can take, or we as individuals can take, to make sure that our children and even adults in our families are supported, are feeling heard, are feeling like their needs in this particular aspect are being met?
Oh boy. So know the facts, educate yourself. I think that's really important. Choose your words carefully. It is not, I hear people say certain words for people that are dealing with mental illness that can be degrading and demeaning, and I don't think that that helps the conversation any. And I guess it's important for parents to role model for their children, so they need to be open to have this discussion before the children can be open to have it. So that would be my thing, that know your facts and be open to discussion.
Yeah, I would 100%. Modeling is a huge thing for parents. You know, it's at the same time, it's also never too late. So I think keywords, also utilizing the principles of Gurbani is have that empathy, compassion. There's a lot of psychology within our tradition. The names of the Panj Pyare, the Char Sahib, they all stand for virtues that, also have a lot of underlying therapeutics. Have compassion, daya, taram, have discipline, himmat, courage, and so utilize that aspect of our culture. It's there. It's already there. You just create as a foundation and build on it. Use our cultural traditions, use our oral traditions to kind of point and plant seeds, as Banji was saying earlier. Start to plant those seeds. Do storytelling. A lot of kids envision, and you can really enrapture them in storytelling, and they can really feel in that oral tradition. So it's really, really, I think it has a lot of weight in our community. And then discipline, practice what you do. And model that it's okay to make mistakes. Nobody is always at Chardikala. Chardikala is somewhere we strive to achieve to. And it's okay to make mistakes until we hone in that mechanism of Chardikala. And when we hear about it in our ancestors, they've honed it in. It's a struggle. And as a Sikh, we all struggle. We're supposed to go towards a struggle in that way. So it's a practice. So just practice that. That's what I would say.
Just before, you talked about like stories and sakis to talk about mental health. Are there specific resources that can help parents sort of kickstart doing that? Do those exist?
Yeah, there's actually a lot of books on Amazon. I know because my wife Sonu wrote a children's book for that reason, just to start creating that dialogue. And so Amazon has a lot of books for kids. Okay. I think there's various websites also on the internet that have kind of stories and storytelling. As a parent, as you do everything else, to review it first before you put it on to make sure it fits your kind of lens.
Absolutely.
But I think also we could tell the stories we tell and talk about feelings and thoughts in between it, right? So what do you think she might be feeling at this point when this happened? What do you think could be done? Who could have helped her? What would you say to her if you could speak to her in this moment, right? And I think all those kinds of things also teach children about feelings, about how to intervene, how to support each other, how to support themselves. That could be really useful. The one other thing that I would say is I think that it's equally important for us to hold on to our Sikh traditions and use our Sikh traditions and for lack of a better word, rituals that we have in Sikhi, and also to be welcome to owning some other traditions from other backgrounds, right? So sometimes our kids will bring things in to our homes that we're like, what is this, right? But if we have conversations about that and if we find them useful, we can own them too, right? Not in a colonizing way, but in a, we accept it, we cherish it, we celebrate it. And these are new things that we're going to bring in. These are going to be our family's traditions together, in addition to the Sikhi that we share.
And sort of, I don't want to not address the issue of bullying in the community, and especially with young kids. Are there any specific strategies that, especially when they're not particularly open to sharing this outside of the family, are there strategies that we can recommend? Like, how are we building confidence in our kids, right? Like, how are we doing this without just sort of saying, oh, ignore it? right? You don't want to tell kids to ignore what's going on. Like, what are some ways that we can build confidence and yet help them address a very real issue in our community of bullying?
I think, again, not to oversimplify it, but I think the more we talk about it, the more we will be able to help our kids, right? I remember when I was young, I experienced some bullying. I grew up in an all-white community, and I never told my parents. I'm not quite sure fully why. I can tell you in hindsight maybe why. I didn't want them to have that added burden in their life. Maybe I was embarrassed. Sometimes I was, as a young child, maybe sometimes I was embarrassed by the turban. Again, in an all-white town, right? So thinking about like, what are kids sort of, sorry, I lost track of the question.
Just how are we building confidence in kids, right? So they're able to talk about these issues, but also be able to cope.
Right, so I think just having these conversations, right? So similarly in therapy, when we introduce an idea or we talk about an idea, we make it okay to talk about that idea in the room, right? Same thing with parents, siblings, community members. The more we talk about these things in gurdwaras, in homes, in these other spaces, the more it becomes okay. Bullying is a real thing. Kids do get bullied. Kids do get picked on. Adults get picked on. Adults experience discrimination, Sikh adults and Sikh kids at high numbers, particularly post 9/11. And so it's real. And I think the more we talk about it as sort of a real thing that is unique to Sikhs, but also intertwined with other oppressed peoples, right? So there's similarities and differences with Black folks, with Latinos, with Indigenous people, and understanding and respecting those differences and those similarities, both in the lived experience, but also the experience of discrimination, I think can be really helpful.
Yeah, 100%. I think, also being able to label what's happening, right? There's, in like 2 lines, there's fMRIs that are done that measure you look at your brain, but it functionally looks at how your brain's working. And they would have, I don't remember off the top of my head, but they had a study where they had the person in the fMRI in the machine, they showed them a emotional picture that would garner some sort of emotion. And when they you had spikes in activity in certain areas of the brain, but when they labeled that emotion, the activity went down. So there's the aspect of just talking about it, labeling it. It starts that process of healing. And then if you're able to be aware of the problem, then you're able to regulate or then start to work towards the problem. I think that's the first step. So it is might seem oversimplified, but is that simple? It really is that simple to start with.
I agree. Having a conversation is the first step. And it is hard for kids to open up to parents if parents haven't created that kind of an environment for the kids to start out with. So that's what's important to do, so that they are more open to have that kind of a conversation with you.
So this is a fantastic conversation, and from the comments and questions we're getting, one that definitely has been needed. We've talked a lot about the importance of continuing to have conversations as a community, as a Sangat, and I cannot thank you all enough for joining us this afternoon. We could talk about this for a long time, but we do have another session, and we hope that everybody's enjoyed summer series. We have shared the contact information for all of our amazing panelists in the chat, so please definitely check that out. And please feel free to reach out to us at the Sikh Coalition. We're also happy to find ways to keep these conversations going. Once again, thank you all so much. Dr. Jasjeet, Dr. Ahluwalia, Dr. Ravinderpal Singh, thank you all so much for your time today and for being part of this conversation. And I hope all of you have taken some really important steps, just everything from how are we as a community working to remove stigma from having these conversations to some concrete steps that we as individuals and as Sangats can take. We will keep the conversations going. In the meantime, Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.